Hi everyone, thank you for being here today. My name is T. My topic today is about the approach of machine learning in responsiveness to 5-filler uracil in pancreatic cancer. As you can see, the pancreatic cancer remains as one of the most challenging cancer to treat. In 2024, a report showed that approximately of 78% case will result in death, as shown in the data on the screen, and the drug of 5-filler uracil, when combined with other drug treatments, show effectiveness to enhance overall survival rate. Therefore, our study aimed to identify biomarker distinguishing between the responsive and unresponsive group who consume fuller uracil-based chemotherapy. Now that moving on to the method, patient data is analyzed from Know Your Tumor program of the Pancreatic Cancer Action Network's SPARK platform. Then participants in our age, gender, ethnicity group, whose line of therapy involve full yourself and show outcome of complete response and or progressive disease were evaluated. Then our program was used to identify gene differentially expressed by using overrepresentation analysis, enrich our machine learning with random forests and decision trees, and the Boruta algorithm. As a result, a cohort of 129 patients was reported. Within that, 90.93% reported with progressive disease, while only 9.17% reported with complete response. The figure beside showed the enrichment analysis with 20 significant pathway that has the p-value of less than 0.05. And as you can see, the metabolism pathway has shown with over 60 genes that is differentially expressed on the pathway. However, we found it's really interesting to focus on the three common pathway, which is complement cascade, hemostasis, and formation of fibrin clots. Then, when using the machine learning with random forest and decision tree algorithm to predict the responsiveness of pancreatic cancer patients to 5-filler uracil-based treatment, we found that there's a really big gap between the response and non-response group, so we apply SMART to promote the balance of the two classes before running the algorithm. And then, as a result of tenfold cross-validation, the random forest outperformed decision tree in all metrics for both classes. And this result implies the using of random forests to enhance the accuracy of the effective treatment plan. However, the two algorithms show really high accuracy, which leading us to the decision tree visualize the hierarchical connection of gene expressed to predict the response and non-response group. As you can see here, the first box of EPHX4, if it is over or equal 54, we can consider to have the non-response to the 5-filler uracil-based treatment. However, if it is less than 54, we can consider the participation of FETUB and a downline gene that can really predict their response and non-response group. Furthermore, upon analyzing, we combine all of their genes that's showing here to see the relationship, and we found that these genes represent their complement cascade gene and even the neuronal receptor. However, complement cascade is one of our most focused pathway at this time. Additionally, we use Boruta to identify the relevant feature by comparing the importance of original feature with random and shadow feature, and it's really helped in selecting the most significant variable. As a research, there are 8 important genes that are significant predictor to responsiveness to 5-fluorouracil-based treatment in pancreatic cancer, especially the highest importance with IRF4, as shown on the figure. Overall, these genes also show the relationship with interleukin signaling, immune system, interferon, and especially the complement cascade that we have mentioned earlier. As a conclusion, all algorithms support the fact that 5-fluorouracil resistance is significantly associated with specific gene. And according to that, the article support that FOLFIRINOX treatment increased the risk for VTE, ATE, which is related to one of our pathway of formation of fibrin clot. Additionally, a synergistic combination regimen of 5-FU and anti-CD25 support the treatment to eradicate a tumor, which is related to the 8 important genes from Boruta algorithm. Therefore, for future development, the research will expand to the transcriptional regulator network of the gene differentially expressed and the mutation of that associated with 5-FU-based treatment. This is a really promising step moving forward for the research at this point. And this is the slide for reference and the QR code that leading to my poster. Thank you so much for your listening.